Hello everybody, I'm Jed Kearney, the Assistant Minister for Health and Aged Care. I'm recording this message in Canberra on the lands of the Ngunnawal and Ngambri peoples. I pay my respects to elders past and present and extend that respect to any First Nations people with you on World Obesity Day. Firstly, I'd like to start by acknowledging our wonderful hosts today, the Obesity Collective, for all the work you do to address the consequences of obesity on the health and well-being of Australians. Obesity is a complex condition. It's influenced by social, environmental and economic factors. It's a condition that is found all around Australia and all around the world. Tackling obesity is key to unlocking healthier, longer lives for so many people. Many years ago, I was a nurse at the Austin Hospital. I saw firsthand the challenges that obesity can pose for an individual, for their loved ones and the people caring for them, and for the healthcare system itself. Australia has one of the highest rates of obesity in the world. In 2022, 66% of adults aged 18 and over and 28% of children and adolescents aged 5 to 17 were living with overweight or obesity. Now, if the current trend continues, more than 18 million Australians, that's 2/3 of the population, will be overweight or indeed obese by 2030. But we also know that there are different populations within Australia that have a high prevalence of overweight and obesity and therefore need extra support. This includes people living in regional, rural and remote areas, people with mental illness, people from culturally and linguistically diverse backgrounds, and the LGBTIQA+ communities. That's why the work of the Obesity Collective as a peak body for obesity in Australia is so important. Transforming the way Australia thinks, acts and speaks about obesity. You're at the forefront of a conversation and growing recognition that obesity is a systems and societal challenge, not a personal failure. Your vision to create a network for collaboration to change the narrative around obesity and advocate for action to create healthier environments and better support from the health system is absolutely key to creating change. It's a vision that this government shares, because we know that obesity just doesn't impact our health system. It impacts our communities, society, and economy. In one study, it was estimated that obesity may cost the Australian community $87.7 billion by 2032. It's because of these reasons and the work that you all have done that the government released the National Obesity Strategy. This is a 10-year framework to prevent, reduce, and treat overweight and obesity in Australia. There are two key 2030 targets: halting and reversing the rise in obesity in adults and reducing overweight and obesity in children and adolescents by at least 5%. Labor's committed to working side by side with the Obesity Collective and the broader sector on these targets. It offers a way forward to tackle obesity through a better food system, getting Australians active, improving our built environments, providing person-centred support through the health system, and taking action in a non-stigmatising way. But, as I am sure you would all know, addressing obesity will need the collective expertise and efforts of everyone here today. Today's virtual event, the Obesity Collective's 5th, brings together a range of experts in prevention, treatment, lived experience, and government from across the country. The work you all do in the community to achieve the ambitious goals of the strategy should be commended. I thank you all for being here today to talk about this significant issue that is affecting the health and well-being of Australians, and for your ongoing dedication and commitment to address overweight and obesity. I want to absolutely reassure you of the Australian government's continued support towards this important issue and your work. It's only fitting that the theme of this year's World Obesity Day is Let's Talk About Obesity and. It's about starting conversations, looking at health, youth, and the world around us to see how we can address obesity together. And that's precisely what today's event is about. So I urge everyone to be part of World Obesity Day. Let's have the conversation. I wish you well in your discussions, and I look forward to hearing the outcomes and your ideas for a way forward. Thank you.